I'd like to welcome you all to the Healthy Lakewood Foundation's 5th annual community meeting. My name is Kate Ingersoll, and I'm the executive director of the organization. It is just a thrill for all of us to be here with you. It's pretty amazing to be thinking about 5 years and realizing how far we've come. And that is in large part due to so many of you that are here, and obviously the Lakewood community as well. I'd like to just ask for a moment if the Healthy Lakewood Foundation board members would be willing to stand up and just wave so that folks get to have a visual of who you are and so that folks can see the folks who are at the heart of this organization and who have been working diligently for so many years together to start to manifest this organization into what we will hope to share with you this evening. I'd like to also acknowledge Sharon Schultz, and Sharon Schultz is HLF's newest staff member. She is our foundation and grants coordinator. She started in July, and we're delighted to have her here. I'd also like to acknowledge Lori Jolliffe, who's here. She has been an executive consultant with HLF, helping us with all of our organizational, administrative, planning work for the past 2 years, and has really helped us to launch and to get so many systems down that would have been impossible without her. So we just want to say thank you, Lori. Indeed. I'd also just like to acknowledge any of the elected officials that are in the room. I'd like to acknowledge Sarah Keppel, who's here with Lakewood City Council. She is our vice president, and also Nora Katzenberger, who is also a Lakewood City School Board member. So thank you both for attending. We appreciate it. Oh, and Emma Petrie Barcelona. Hello, sorry. Emma is also on the school board. Thank you for being here. I am going to hand it over to Sharon, who's going to get started into our program.
Thank you, Kate. So we do have just kind of a tradition at these meetings to begin with a brief centering activity. So our board member, Chitra Walker, is going to guide us in a short meditation. She is one of our inaugural board members. She's been practicing meditation for many years and is a longtime Lakewood resident. She currently works as a youth resource specialist in the City of Lakewood's Division of Youth. So Chitra.
The meditation I've chosen for today is about gratitude and connection. Through the practice of this meditation, using both my mind as well as my imagination, I am learning how feeling gratitude in my body can impact the way in which I can be intentionally aware of and connect with those around me. We will begin our meditation by finding a posture that feels relaxed and alert. Feel your body touch the chair. Sense the points of contact with what's underneath you. Feel the weight of your body. Notice the rise and fall of your belly as you breathe. Gently drop your shoulders, soften your hands, loosen your jaw, relax the muscles of your face and around your eyes. You can look downward or close your eyes. Settle into yourself. Take a few breaths and let your mind and heart begin to imagine. As you now shift your awareness to reflecting on your experience with gratitude around relationships with others. Where have you felt gratitude in your relationships? How would you express this gratitude? Notice how your body feels as you reflect on these relationships. And as you begin to experience the feeling of gratitude spreading through your body, breathe. Breathe in gratitude. Breathe out appreciation. This is a practice of sharing gratitude. Breathe in, breathe out. Now imagine the people who are present in your mind's eye, joining hands, forming a circle with gratitude spreading from each heart in the circle to the next, forming a ring of gratitude. And in your mind's eye, thank each person in your circle for being present here. Now, gently allow the scene to fade. Bring yourself back into your body with your next few breaths. As you allow your eyes to open, take a couple of deep inhales and a couple of long exhales, and gently return to the present, feeling loved, appreciated, and deeply grateful for the connections in your life. Thank you for opening yourselves to this meditation on gratitude and connection. Thank you for being here now and present.
Thank you, Chitra. Okay, I'd like to bring up Chuck Garvin and Becca Boss. They serve as co-presidents of our board. For over 40 years, Dr. Garvin has served the Cleveland and Lakewood community as a family physician and community leader, and he's currently the Chief Medical Officer of the Sisters of Charity Health System, and he is one of our inaugural board members. Becca Boss is the manager of the UH Rainbow Center for Child Health. She is a Lakewood resident and an inaugural board member as well, and she is the chair of our Community Engagement Committee.
Thanks for coming. And you would think if I was going to talk for a minute and a half, I could have memorized everything. But I wrote down a few things, not because I couldn't remember, so that I don't go off script and I finish on time. I wanted to tell you that besides being on this HLF board since 2018, I'm one of several people that I've seen here tonight who were on the task force that had the opportunity to write the code of regulations that formed this HLF task force. And I'm here to tell you that that crew that got together wrote all the code of regulations. We're the ones who said that 2/3 of members of this board had to be residents. We made the quorum rules. We were pretty specific about the need for diversity on this board. We were also very, very intentional about need for community engagement. And we did a number of things written right into the code of regulations for community, to make sure that we stayed grounded in being engaged with folks in the community. One of the things that we prescribed was this meeting. This meeting has to take place annually. It happens in September, and it's just a time to make sure that we can inform folks, that we can consult with folks, involve them, and to really kind of a listening session as well as an information for you folks session. The meeting is put on by the Community Engagement Committee, and besides being vice president of the foundation, Becca is also a huge part of putting together this meeting. I'm going to let her tell you what we're going to do the rest of tonight.
Thanks, Chuck. So as Chuck mentioned, that the foundation was really intentional in our bylaws about accountability to the community and why we're all here tonight. So thank you so much for taking time out of your busy lives to join us. I want to provide with you just with a quick overview of what we intend to share tonight and what we'd like you to take home with you when you leave. We're going to start by highlighting the work of the foundation, and you'll get a chance to hear from members of our board as well as our staff about how we really put into practice the priorities that we've set for ourselves for the year. We'll then transition to some focus around our grant-making strategies. We have 3 types of grants, and we have representatives with us here tonight from each of those grant types that are going to join us for a panel conversation. So from the neighborhood paramedic practice, which is a system-level grantee, we've also got a representative from neighborhood family practice that has a community-level grant with us, and then Trials for Hope, which has a neighborhood opportunity grant from the Healthy Lakewood Foundation. We really look forward to hearing from each of these grantees about the ways that they're operationalizing and bringing to light their work as they increase access to healthcare and resources and supports here within our community. We'll then pivot to talk about the ways that we are really, again, here's this word, intentional, about integrating feedback from the community. So we really pride ourselves, even 5 years in, we are learning every single day about how to be good collaborators, good partners, a foundation that listens and learns at every turn. And so we're going to be joined by one of our consultants who just completed a round of stakeholder and grantee interviews, and Kate will share with you some key learning points that we'll integrate into our practices and our strategies going forward. And finally, we'll wrap up as we look ahead and think together about how we can continue to advance health and well-being in the Lakewood community. With that, I'd like to invite you to think about the questions that you have as we're talking throughout the evening. There'll be some opportunities for you to ask those questions of board members, of our panelists. If you'd rather have a one-on-one conversation, we're all, of course, available to stick around and talk afterwards as well. And with that, I'm going to turn it over to our incredible board president, Kalila Worley-Billy.
Good evening, everyone. I'm Kalila Worley-Billy. In my professional life and my day job, I'm the senior organizer with Greater Cleveland Congregations. I am an inaugural board member, and I serve as the HLF board president, along with the co-celebrator with Dr. Chuck Garvin, when we make sure we bring the energy and the celebration to our board in terms of the incredible work that we are doing, and as well as the laughter. You all can laugh and chuckle and be a part of that with me. I'm also going to be mindful of time because your time is important. And in this moment, we're just going to reflect on what it's been like for 5 years. If you haven't taken notice, we have a board back there at our first inaugural meeting that captured the work that we had hopes for as a very new board coming together. And we have that same opportunity today to capture what it will look like, and it will capture our meeting and put feelings to these words and not just words on paper. At these community meetings, HLF board and staff have shared our progress over the past year with the Lakewood community. At this meeting, we have the opportunity to share a 5-year look back since our founding and reflect on how our efforts have been shaped by community and world events. As a board member, at our first meeting, I can recall in September 2018, when we all gathered at the Women's Pavilion, most of us strangers, and welcomed at that time by Mayor Summers and his team. We were provided a briefing on the background of information of the foundation, and at the current time, the balance was $8 million at the time. Dr. Roland Anglin graciously stepped in to lead that first meeting and naturally became our interim and then first board president. We self-organized by areas of expertise and interest. We determined that we needed to learn more as a group, and certain members organized board education sessions with presentations on the social determinants of health, Philanthropy 101, just to name a few. Those with financial strengths, led by Peter Kroon, developed an investment strategy, the short and long-term stewardship of the assets entrusted to HLF, securing everything from checking account and later an investment policy statement. We determined that we needed support in creating a strategic plan and created an RFP process to select a consultant to work with us. It was a 9-month engagement that resulted in our strategic grant-making framework approved in February 2020. February 2020. We were so confident about our approach and trajectory until we realized, like the rest of the world, that we should hold our March 2020 board meeting via Zoom. What? Zoom. Back then was a foreign word. Right now it's about as common as I say my name. But we were out of an abundance of caution due to the developing spread of the COVID-19 virus. It quickly became apparent that we would need to pivot, and with the guidance of our then board president, Janine Gurgel, we called a second March board meeting to approve 2 grants, one to the Lakewood Community Services Center and one to the Lakewood Department of Human Services for emergency support for Lakewood residents. In the words of Harold Melvin in the Blue Notes, the world won't get no better if we just let it be. The world won't get no better. We gotta change it, yeah, just you and me. And so it went. The best laid plans laid aside to respond to the crisis before us all, with the intention of supporting the community to the best of our ability. The COVID pandemic showed us the adaptiveness, resilience, creativity, and determination of Lakewood servant organizations getting food, housing support, PP vaccines, remote learning technology to students, and more to community members in need. Nonprofits and agencies provided crash courses to HLF board members about their work and the needs of the community. We determined that direct COVID response funding to the Lakewood community was an important role for HLF, and we engaged this strategy in 2020, 2021, and into 2022. 26 COVID response grants over the past 3 years. We also determined that we would need more staff to move forward with our goals. We did all this before having staff. But in July of 2021, HLF's first executive director was hired. Thank you, Kate, for accepting that position and leading us continuously along the way. Many of you know Kate and know that it was important that we engage community efforts, conduct grant making, and build out internal functions, and she has been a thorough student and as well as a steward of that initiative. In 2022, it was time to open our grant processes. HLF provided over $500,000 in funding last year through our community neighborhood opportunity, system levels, and certain COVID response grant making programs. You will hear more about this later tonight. Since the start of grant making in 2020, HLS has granted over $1.3 million through 54 grants in support of the Lakewood community. Like all of you, our organization was forever changed by the COVID-19 pandemic. Many of our ideas about how we would create change in Lakewood were challenged. COVID exposed greater health disparities than we understood at the start of this foundation. The Community Health Needs Assessment, with its extensive community data and surveying, is a guide for understanding and addressing these disparities. We share this look back to express the impact of what has been a life and organizational altering time. HLS is moving forward, and greater awareness of both Lakewood's strengths and vulnerabilities, which reflect larger systemic issues. From our perspective, and myself as board president, Lakewood is positioned to address health inequities and prepare for future challenges. But it will require new levels of resident engagement, centering grassroots advocates, stronger collaborations among institutions, and strategic financial investments. HLF is positioning itself to be a part of these collaborations and efforts. And to close this with more from Harold Melvin, wake up, everybody. Wake up, everybody. We need a little help, y'all. We need a little help. We need some help, y'all, to change the world from what it used to be. We'll now hear from Kate Ingersoll, our Executive Director of the Healthy Lakewood Foundation.
As mentioned in 2022, HLF launched its comprehensive strategic grant-making process, and we were engaging 3 different types of grants: the community grants, neighborhood opportunity grants, and systems-level grants. And you'll get to hear from grantees that represent each of these processes in a little bit. In 2022, HLF made over grants totaling over $500,000. We made 36 grants last year. And included in this total is some of those funding for the COVID relief efforts. HLF has initiated our comprehensive grant-making process, and I want to, in that process, acknowledge the incredible efforts of our grantees to educate HLF staff and the board on community issues and the needs of our residents. Truly, this is it's a symbiotic kind of ecosystem whereby we are learning from you in real time so that our grant making can continue to increase in its value, in its responsiveness, and in its capacity to serve the people who are most in need in our community. I'd like to just direct you that if you would like to have more details on our funding, we have some reports, we have some breakdowns of our data, so I won't spend a lot of time sort of repeating that back to all of you, but I do want to make sure that if you'd like to take an annual report or any of those, that you know that they're in the back and you can access those while you're here. You can also always access that off of our website. One thing that we talked about at our last community meeting in 2022 was the community health needs assessment, and we were fortunate at that time to have a researcher who had helped to conduct the community health needs assessment report out on the learning from that. There were many grantee partners and many people who were a part of that process that are here in the room today, and it was a process that was initiated by the City of Lakewood in 2021, and it was a collaboration between city departments and various community stakeholders. Many reported after that meeting that they were surprised to learn both encouraging and troubling statistics about the health of our community of 50,000 residents. Folks were surprised to know that our childhood poverty rate is 18.7%, that 7.5% of residents do not have health insurance, and that positively 88.75 or 89% have a primary health care provider, which is higher than most averages. After the assessment was published in September, the community was provided the opportunity to offer initiatives, programming suggestions, policy recommendations, and other feedback to the CHNA team to consider. We used a charrette model for community engagement, and we received what we called interventions, 54 of them from the community. And of those 54 interventions, 158 reactions came either in support of or building off of ideas and suggestions. The resulting action plan from all that feedback was incorporated into a report that was published in December of 2022. So what has been happening with the community health needs assessment since then? In March 2023, a formal committee was established through Lakewood City Council to put the CHNA into action. This governing committee is comprised of representatives from the City of Lakewood's Planning Department, the Department of Human Services, a member of City Council, the chair of the Health and Human Services Committee, Sarah Keppel, the Lakewood Recreation Department, the Lakewood City Schools, the Three Arches Foundation, and the Healthy Lakewood Foundation. This team has reviewed all the action items from the plan and has organized all the feedback into 5 categories, and this is where our work will continue. we are going to start to engage all of this, a variety of different stakeholders to come and start to work in a subcommittee format so that we can start to tackle what issues we see as being the priorities out of that report. And these 5 priorities include food access and security, housing access and affordability, out-of-school time and enrichment, access to physical and behavioral health, and community information strategies. I warmly welcome any of you who are interested in learning more about this process to reach out to me to learn how you can be involved. And I also encourage you to look at the work that the committee has been doing since the CHNA was published, and all of that information is on the City of Lakewood's website. Finally, I'll share as an update for this year that HLF decided that in its 5th year, soliciting community feedback on our process thus far was important. As a funder that's committed to incorporating the trust-based philanthropy model into our approach, we value the candid feedback of our grantees and our stakeholders. And there were 3 areas that we were particularly focused on. We wanted to know, what is the perception and the experience of engaging with HLF as a community partner? What's it like to go through our grant processes? Are they burdensome or challenging for applicants? And is there guidance on the roles that HLF should play or not play in the community that our community partners and stakeholders can give us? So HLF returned to the consultant that helped us to develop our grant-making strategy in 2019. Jeff Glabaki of Strategy Plus Action Philanthropy is going to actually join us live via Zoom to share some of the key learnings from that survey. We want to do this because we've asked Jeff to demonstrate in real-time responsiveness to the feedback that we received and to be accountable to the recommendations. These are the initial recommendations. And these are just the sort of top-line recommendations that we received. We are going to dig into these as a board at a board retreat that's coming up in October, where we'll really dig into the feedback that we received and then start to work to make sure that our grant making and the work that we're doing is responsive and aligned with the feedback that we received from so many of you who are a part of it. Jeff's going to tell you more about that survey, and this feels like the kind of Wild West trying to do a live Zoom on a Wednesday night, but let's make it happen.
Well, good evening, everybody. It's great to be with you. I cannot see you on camera. I think you can see me on camera. But I do want to say hello to all my old Lakewood friends and my new Lakewood friends. This kind of reminds me something that a few of us in a certain chronological demographic might remember. The Miss Barbara kids TV show, where at some point during the show she would hold up her magic mirror and look out into TV land. So tonight I'm doing that, and I see Kate and Sharon and Kurt and Courtney and lots of other folks. Before we walk through the learning highlights, I want to say thank you to lots of folks, to the Healthy Lakewood Foundation board and staff for being interested and willing to ask the community, how are we doing? I work with a lot of foundations around the country, and I'm sorry to say that not every funder is willing to do this. So thumbs up for you all. In particular, I want to thank Chitra, Melissa, and Kalila on the board for their input in shaping the inquiries we used. And of course, to staff members Kate and Sharon for all their extra efforts and their due diligence in getting this organized. And I can't forget Lori, thank you for wrestling the calendar gods to the ground and getting things organized for us. So thank you very much. We used 2 data points for this learning journey. The first was a confidential online survey of grant partners. I'm really amazed by the response rate we got. There is something called survey fatigue that was brought on by the pandemic. It's a real thing. We used a fairly short survey so that this was not a burden to grant partners, and I think that worked because of this amazing rate of response we got. So that was great news. I conducted 17 one-on-one interviews with community stakeholders, all via Zoom over the past 2 months. What I'm going to walk through now are the highlights or the headlines of what we learned. Next month, I'll be sitting with the board and the staff in a 2-hour learning session where we're going to explore the headlines, but we're also going to dig deeper into some of the nuances and the insights that emerged and talk about how the foundation might refine and respond its work to this kind of community feedback. So the good news is that the Healthy Lakewood Foundation has a really positive reputation in the community. We used a number of survey and interview questions, so we came at this from different directions, and there was this consistent theme. People see you as accessible, responsive, transparent, fair, collaborative. The foundation is visible in the community, and the foundation is considered a really good thought partner. So literally and figuratively, thumbs up. What we also learned was that there are a couple of needs here to follow up on. The foundation, grant partners, and the community at large would benefit from Healthy Lakewood Foundation undertaking more intentional communications. And that means to help people understand how and why the Healthy Lakewood Foundation is unique, and help people understand why the foundation is different from other funders. The second need for this outreach is really to engage audiences beyond the usual suspects, as the phrase goes. This might include grassroots organizations, it might include larger regional nonprofits and others. But folks felt like it would be worthy for the foundation to undertake that kind of outreach, communications, marketing, etc. The foundation also gets high marks in its grant making and strategies on being helpful to the community in general, but also to its grant partners specifically in strengthening their capacity to build a healthy Lakewood. That's not a small achievement in the short time that you all have been grant making under the strategic plan. I'm going to guess most of you have at least heard the term social determinants of health. These are factors in our everyday work and life environment that affect our health and affects the community health. Contingent on the source or the lists of social determinants of health you consider, there are usually 30 plus of these. The foundation has intentionally built its grant-making strategies around the social determinants of health. The good news is that grant partners generally understand what social determinants of health are, why they're important, and why the foundation has built its grant-making strategy on these. But there's also an opportunity to do some refinement and clarify for grant partners and the community the what, the how, and the why, how the foundation is using social determinants of health. Similarly, grant partners generally understand your grant-making strategies, neighborhood opportunity grants and community grants. And I often heard people refer to the neighborhood opportunity grants as the small grants program of the foundation. But people generally understand there are these different approaches to building a healthy Lakewood. Similarly to social determinants of health, there's an opportunity to clarify terminology, to help people understand the difference between these strategies, why it's important and what each strategy is working to accomplish, how they're packaged, how they play out in the community. When I work with funders in this kind of surveys, interviews, focus groups, et cetera, trying to get feedback, I always encourage folks to use open-ended questions. And this is a chance to invite people and organizations to share their ideas. What do you think this funder should think about? What are you worried about? What have they missed? Where are the opportunities they should give consideration to? So did exactly that. And there were really 4 major themes that surfaced. The first, which is the big question all funders get, are we making a difference? And if so, how? For example, we heard lots of positive comments about the neighborhood opportunity grants, the small grants. But we also heard more than a few people say, yeah, those are great, but what's the impact of those small grants? And that's a big question, no pun intended. The second theme that surfaced, as a relatively new foundation, Healthy Lakewood is still defining and refining how it makes change. Clearly, it's more than just the money, it's more than just the grants, but it's really what's the toolbox that you want to build and you want to apply? Facilitation, convening, leading, supporting, amplifying other voices. Those are the kind of things that the board and staff will be considering. And a sidebar note to keep in mind, the foundation's assets will continue to grow in the future. That will change the question and the answer to this second item around how you affect change. The third issue is how to deploy these resources, how to deploy board and staff leadership, and then when and where do you do that? This is where the art and science of philanthropy comes to the surface. A couple of suggestions that came up in the learning about particular issues or inflection points: mental health, which post-pandemic, particularly in youth populations, is a huge problem. Farmers market, a number of people saying, bring back the farmers market. Micro transit services in the community, helping create or support some sort of navigation service so that people and organizations can find the support they need. And a couple of grantees talked about, could the foundation connect us as nonprofits to policymakers, which might actually amplify their work. And the last key suggestion was follow-up to the Lakewood Community Health Needs Assessment. It's been completed. I understand there's now an action committee, which the foundation is represented on, to look at proceeding with implementation. But a question for the foundation is, what's your role? How big of a role do you want? In what ways do you want to influence this work going forward? So those are the top notes. I hope you found this helpful. I understand time is running out. Is that so? I've run out of time to share my brilliant insights. I hope this was helpful for everybody, and glad to follow up through staff if anyone has particular questions or curiosities. Great. You bet. Have a great night. Thank you. Bye-bye.
So we will, if folks have questions that they'd like to share, feel free to email me, and I will warmly welcome those and make sure that we respond to you. We are going to do a quick transition into our committee updates. We'd like to have board members come on up and who are the chairs of our various committees to report on some of the work that we have done over the past year. I'd also just like to acknowledge that we have a few more elected officials that have attended. Mike Callahan, who is a school board member, Cindy Marks, and Tom Bullock, who are Lakewood City Council representatives. Thank you for being here. So I'm going to turn it on over to Erin Murphy, who is a member of our Learning, Evaluation, and Assessment Committee. Thanks, Erin.
Hello. In my professional life, I'm the Director of Health Promotion and Chronic Disease Prevention at Lorain County Public Health. And I'm an inaugural board member, and I also was a co-chair of the Foundation Planning Task Force that established the Healthy Lakewood Foundation. And since we are doing kind of a look back in time, I would be remiss if I didn't share this anecdote with you. When we were putting together the structure and thinking through what we would package up and hand over to this board as the task force, one of the things we said was, well, we want to make sure it's flexible enough so that the foundation can respond in the case of something like a pandemic. And since there's several of us here that were part of that task force, I'm going to make sure we keep our distance from one another so we do not speak anything else into existence. I really was reminded of that just now. I was like, we literally said that in a meeting. But anyways, this is perfect because Jeff's presentation and Kate's presentation and sharing out on the chinda before this perfectly tees up what I have to share from the LEA committee. I do want to acknowledge Chitra Walker, who's my fellow committee member, and I want to acknowledge Kate too, because we are a small committee and she probably helps us more than she has to help other people. So thank you, Kate. But it's teed up perfectly because as a public health professional and leading a team of public health professionals, one of my favorite mantras that I share with my team is that action without data is foolishness. Data without action is wastefulness. So we've talked a lot already today about this information from Jeff, information from the chinner. What are we going to do with this? How will we embed this into our continuous quality improvement as a board, as a foundation? So that's what our plan is going forward. And to do that, we'll continue implementing our comprehensive grant-making strategy. The LEA committee reviews processes before they go live. We look at board committee member feedback, and we look at survey feedback from grant applicants. We helped Jeff, and we helped oversee the work that Jeff did in getting the community feedback that he just presented. And we'll continue to use that and make changes, not in 5 years, not in 10 years, now. Data without action is wastefulness. In addition, the LEA committee oversees board education, and we help plan information sessions that we can help expand our board's knowledge, because this board does value being continuous learners. There's always something more to learn and know. And in addition, evaluation being one of my most favorite things, we help review all the grant reports and staff summaries on progress of the grants, make sure that periodic check-ins are being done with grantees, review our process for evaluating the grants and looking at grant reporting, and then understanding how we're going to integrate that learning into improving our own systems to make our grant making more effective. So with that, I'm going to invite Becca back for some community engagement committee updates.
All right, thank you, Erin. I would be remiss if I didn't acknowledge the wonderful people in this room that make this committee vibrant and exciting. So Rick and Courtney, if you can give a wave. We're going to get to see a lot of Courtney here in a minute. And also, this is the first time that we've stepped into a new space. We have community members who are part of our community engagement committee, and we have Danielle Locke here with us this evening. And also Sue Finley serves on our committee as well. And Danielle and Sue bring this incredible expertise and experience in marketing and communication and community engagement and event planning. And much of what you're enjoying about your evening tonight, we have them to thank. So we appreciate their thoughtful feedback and constructive suggestions. And also we have Faith Boone with us here tonight. We've worked with Faith for almost 2 years now. Is that, wow, it's flown by. Faith has a consultant firm that handles marketing and communications, Boone Logic, and she has been instrumental to helping us really accept that you cannot DIY social media. We've had some very frank conversations about how to craft content and how to focus our message and how to create better understanding. And so much of what we continue to learn, Faith helps us put into action. So we're grateful for her continued role with us. She's also working with our grantees to amplify their accomplishments and help them create their own content around their grants. We've stepped into a new space this year as well as a convener of community conversations. We had our very first community learning session here at Cove with the Lakewood Foundation, and we have a wonderful relationship with that organization as they serve as the fiscal sponsor for individuals and smaller organizations that may not be a 501c3 but have a phenomenal idea about how they can contribute to our community. And so we were able to have a conversation about what that looks like and what that means. And we welcomed representatives from the Madison Court Community Coalition and the Lakewood Outdoor Basketball Committee to share their experiences with that process and really show how we take an idea at the grassroots level and make it a reality with the investment of grant funds from Healthy Lakewood Foundation. And last but not least, we'd just like to highlight we continue to do some modest sponsorships of free events in the community that align with our mission, vision, and values. So this year, we were able to sponsor the Lakewood, I'm going to mess it up, the Lakewood Early Childhood PTA, Meet the Trucks. So always a hit with the kiddos, and also the Lakewood Alive Summer Meltdown. We sponsored the Water Moose, so if your kids came home soaking wet, you're welcome. And then we also sponsored the most recent Lakewood Department of Human Services Resource Day that was held at Madison Park. So we'll continue to, again, look for those opportunities. And with that, I'm going to hand it off to, I think Kate's going to update you on governance. All right, thanks.
I'm going to be standing in for Melissa Fetterman, who is our board secretary and also the chair of the governance committee, who got a sore throat at probably 4 o'clock this evening and didn't want to get anybody sick. So I will just acknowledge the other committee members who are part of governance, Kirsten Krashun, Chuck Garvin, Heidi Hilty, and Chitra Walker. Thank you for your engagement on that committee. I would like to note that HLF has engaged a consultant for diversity, equity, and inclusion work for 6 months that will be starting in October. April Walker, the founder of Philanthropy for the People, will support HLF in conducting an equity assessment and in its development of an equity framework. She will also facilitate staff and board learning. This year, HLF also passed a board compensation policy that allows HLF to provide reimbursement for caretaking and costs associated with service on our board, like travel and childcare. This is an effort to expand the opportunity for board service to a broader range of community members by removing barriers for participation in board service. We've also recruited 2 new board members this year, and HLF holds open recruitment processes where we have a call for applications. I'd like to acknowledge Warren Coleman and Rachel Williams, who have just joined the board recently, and we're delighted to have them. And I'd also just like to note that HLF has grieved the loss of Peter Kuhn, who was one of our inaugural board members who passed this past December. Peter offered HLF incredible time and expertise in establishing the financial infrastructure that was needed to ensure the ongoing stewardship of HLF's growth and assets. I'd like to just note that the Kuhn family designated HLF for donations in memory of Peter, which was incredibly generous. And HLF also has an internal policy whereby when board members leave our board as an act of gratitude for their service, we donate $1,000 to the charity of their choice. And Peter's wife noted that Peter and her would be pleased to donate to the Lakewood Congregational Church for the work that they're doing to revitalize their basement space, and so we are happy to do so. Those are all the updates that I have for the Governance Committee, and thankfully we'll have Kurt come on up with Finance.
Okay, thanks, Kate. I'm Kurt Broski, retired after more than 20 years as president and CEO at the Westerly Apartments, Barton Center, Fedor Manor, and some other senior housing properties. I am an inaugural board member. I currently serve as treasurer and chair of the Finance Committee. I do want to acknowledge our other Finance Committee members. They're here tonight: Laura Chalker, Warren Coleman, Melissa Fetterman, and Heidi Hilty. They all have extensive experience in finance and investments. As of last month, the end of the month, Healthy Lakewood Foundation had total assets of $18.5 million. Over the next 10 years, we will receive another $13.2 million, and all of this are from proceeds resulting from the closing of the Lakewood Hospital. The main function of our committee, the Finance Committee, is to protect and invest all of those assets so that Healthy Lakewood Foundation can exist in perpetuity. We do this through 5 major activities. Number 1, we establish financial controls, so we have things like there's not a check that is written that doesn't have the approval of the executive director and at least 2 board members on the Finance Committee. We prepare an annual budget that we review and scrutinize every month, the actual results, actual financial results versus the budget. We develop and maintain an investment policy statement that provides guidelines on how our funds are to be invested. So for instance, to live up to our mission to be healthy, we do not invest in companies that manufacture alcohol, tobacco, firearms, or operate private prisons. In addition, our investments consist of a preponderance of stocks which have high ESG scores. And what that means is that their corporate governance and operations are positive for environmental, social, and governance issues. Number 4, we hire professional investment advisors. So for several years now, we've been working with Huntington Private Bank investment advisors. We meet with them several times a year to review our investment portfolio, and every 3 years we evaluate their performance. And we just did that this year, and they came through with flying colors. And finally, number 5, we review the annual tax return, Form 990, that's prepared by our CPA. And if any of you are interested, you can find our 990s. They're out on our website for public access. Thank you. I think now we're having questions.
Because of time, we're going to actually move on over to our panel. So if there are follow-up questions that folks have for anything that we've shared about the HLF board or our processes, you are welcome to reach out to me. All of my information is on our website, and I would be happy to follow up on any questions that you might have. In the spirit of making sure that we stay as close to time as we can, I'm going to actually ask our panelists to come on up right now, if that's okay, and we'll have you sit down. And we're actually going to go ahead and just start with our panel discussion so that we stay true to time. And we're going to talk a little bit about our grant making, and each of these folks will be introduced by Courtney Noster, who is one of our board members and is going to serve as our moderator this evening. Thanks.
You can clap for me, I'll take it. Good evening, everybody. It's really nice looking out in the crowd and seeing some of my favorite Lakewoodites sitting out there. My name's Courtney Noster. In my professional life, I'm a licensed independent therapist, and I specialize in EMDR, ecotherapy, and other healing modalities to support the growth and development of people. I'm an inaugural board member, so I'm proud to have been with the Healthy Lakewood Foundation since the inception. I've been on the Community Engagement Committee since then, and I've also been a member of our Neighborhood Opportunity Grants Committee, which was my favorite thing I've done so far for the board. So we're going to do one last run through social determinants of health. There is no test at the end of this, but take notes like there is, so you know what you can come and ask us to help you out with for grant partners. And it's just reiterating what Jeff has said, what you've heard a few times tonight, that our grant-making framework is grounded in the social determinants of health, which are the environmental, social, and economic conditions in the places where we live, learn, work, and play. We believe as a board that the social determinants of health are the most significant factors in supporting or hindering the state of health and wellness for the Lakewood residents through all stages of their life. So the ones that we're focused on, they're categorized like this. First, the economy we seek to make a living in, the housing, neighborhoods, and environments we live in, the food we can access and afford, the quality of educational opportunities available, the social support systems and ways we can engage our community, and the accessibility and quality of healthcare. So just take a minute to commit that to memory. These are the things that we're paying attention to. These are the things we really care about. This drives where we send the funds that we have coming through our organization. And since we didn't get our 7th inning stretch, we're going to have a little fun with this next one. I want to talk to you about our grant-making framework. We have 3 different grant processes to allow a range of organizations, a wide range of organizations, to access our funding and for HLF to support the community in a variety of ways. These 3 processes are as follows, and if you want, we can do a little call and response. So the first one is community grants. Say that with me. Community grants. All right. So this is our top support organizational programming that addresses critical needs, addresses disparities, and provides opportunities. Second, neighborhood opportunity grants. Yes, I like this crowd. Thank you. This supports local initiatives that build and support community through activities, events, programming, and or resource sharing. This was the committee I was on, and this was a really beautiful way of experiencing the city of Lakewood's plethora of helpers, carers, take carers, do-gooders, looking out for the people at all levels, especially at the grassroots level. This was just a joy. So neighborhood opportunity grants. And then we have finally our system level grants. All right, good job. We're getting a little tired, but cupcakes are coming soon. System level grants support the work to influence and guide change in structural systems. So these are bigger, wider nets to improve individual and community health outcomes. So far, these grants have been invitation only in 2022 and 23, but good news, that process gets opened in 2024, so keep your eyes out for that. So enough with the groundwork. I know you all know the 3 different grants, and we're going to get to hear from our panelists tonight. So the main event. So let's just give them a hand for being here, and I'll introduce you to them. So let's see. We're going to start far on the left with my new friend Sophia Asmis, who is a patient advocate for Neighborhood Family Practices North Coast Community Health Center. And in the center, we have Ryan Berth, a firefighter and a paramedic with the City of Lakewood's Neighborhood Paramedic Program. Word has it, it's your first week on the job, Ryan. Not even my first week. Not even. So we're really appreciating the minute I met Ryan, he said, I'm so happy to be here. And I think he's still figuring out what he's here for. So we're so glad he's here and glad he came up to share some of the information about this really cool program. And then we have Jonathan Gray, who's the founder for Trials of Hope. Yep. And this is an initiative to support meal programs and community support programs in Lakewood. So we're just going to start off by asking each of you a fairly simple question. And we're just going to ask that you share a few sentences. Speak from the heart. You've got a lot of really engaged citizens that want to know about what you're doing and how much you love it. So speak from the heart. And for, let's see, Sophia, would you mind starting us off, just giving us a little bit of background about your organization and your work in Lakewood?
Good evening, everyone.
There you go.
My name is Sophia Asmus. I've been with Neighborhood Family Practice now for almost 5 years. I know this is rare to say, but I really love going to work every day. I love being able to help people, having resources at hand with whatever they need. It's just an honor, to work with them. And Neighborhood Family Practice, we don't only have medical, we have a dental department, we have a behavioral health department, we have a midwifery department, and we also do free mammograms once a month. And we're integrated healthcare, and regardless of what type of background the patient comes from, if they have insurance, they don't have insurance. We see everyone. We work on a great sliding scale. Everybody's seen and everybody's treated the same.
Thank you, Sophia. Thank you. Ryan, would you like to share with us a bit about the program that you're representing?
Absolutely. My name's Ryan Berth. I've been with the Lakewood Fire Department for a little over 13 years now. I recently stepped into the role of neighborhood paramedic. I'm excited to be here today, so thank you for having me. As far as the program goes, my mission is to identify risks in the community that we can reduce through outreach, prevention, and education that will break down barriers to care, mitigate high-risk behaviors, and improve the overall health of the public. We see our vision as being able to develop public health initiatives, training and education opportunities, and provide one-on-one personal care to the community to improve the quality of life, create environments to thrive both mentally and physically, and create partnerships with stakeholders to improve the ability to reduce risks within the city of Lakewood.
Thanks, Ryan. Jonathan.
Good evening. My name's Jonathan Gray. I'm the founder of Trials for Hope. We're a 501c3 that started in 2010 with a donation of hygiene, and we realized how much so many of us can take for granted. We offered the hygiene throughout Lakewood at different community meals, and from 2010, we've expanded many different areas. In Lakewood, not only do we offer hygiene, but we participate in community meals because 1 out of every 4 people don't have enough, and that's not okay, even in Lakewood. We're currently getting ready to start 2 more meals out of Calvary United Methodist, and our goal is to operate a free store where people can come in and get basic needs besides just food to help them have more of a quality and dignity in their lives.
Thank you, Jonathan. I'm really feeling like a warm heart over here just hearing about these 3 programs and the way that you all in your roles are wrapping your arms around the city. We'd like to know a little bit more from each one of you about the specific social determinants of health that your work is addressing in the community. So a few sentences. Does anybody want to kick us off with that? We don't always have to go in order. Unless Sophia's ready. Yeah, go ahead, Sophia.
So right now, I'm trying, with the food insecurities, I've noticed a lot of that with patients coming into the office. So right now, I'm trying to work with a few of the local businesses, restaurants in the Lakewood area. I did notice, I don't know if you all are familiar with Rude Restaurant on Detroit Avenue. They have a community fridge that I send our patients to that do have food insecurities. They have fresh vegetables, they have different type of breads, milk, whatever you need, it's inside that refrigerator. And patients are allowed to go in there and get whatever they want. They do not have to buy anything. So I'm trying to do the same idea myself as well with reaching out with different restaurants in Lakewood to see if they would sponsor a community fridge. Where people could make donations and the patients do not have to be, embarrassed to go in. They just go in, get what they need, and they leave. That's one of the projects I'm working on.
Yeah, thank you, Sophia. So food insecurity, paying attention to that. Yeah, Sophia was telling me how savvy she can be in seeking, resources for her clients, and I think that's a really good example of that. Yeah, thank you. Ryan, would you like to go next? Talk a little bit about the social determinants of health that the paramedic program is focused on.
Absolutely. The program is still very new, and it takes quite a while to start gaining some traction. So it's all about identifying opportunities and gaining trust within the community and showing the residents that there are services and a value that our program has. So initially, our goal is to find ways to provide access to high quality care for the community by integrating and collaborating with local health systems. We find that extremely important, so transitions to and from the hospital are seamless, working with social workers, primary care physicians, making sure that we're on track with helping residents, specifically 60 and over, with medications. Our main focus is for building the program is to preserve independence for the elderly and allow them to age comfortably in their homes. Slips, trips, and falls is a very big issue with some of the elderly, specifically in our senior living centers. So we want to be able to start gaining access to those patients. We've been doing that through blood pressure and blood glucose checks. We host them here every couple weeks at the Cove Community Center, and then we also have been around to the Westerly buildings doing that. So we're trying to start building relationships with the elderly population so we can start providing services that we're recognizing our needs. We see a lot of repeat falls, and we go on a lot of repeat calls that kind of impact how we operate. So our goal is to find ways to keep them from having to have long-term hospital stays. By addressing these issues, we're able to uncover different opportunities. So we're able to get into the homes and provide in-home surveys, fire safety surveys, and start addressing medications. We find that these are a lot of the reasons why we're seeing falls and repeat hospital visits. So we're really looking to try to get into the homes and help start identifying those risks so we can eliminate them early on. And a lot of the changes that we see are small changes that can have dynamic effects. So it's identifying whether there's rugs or fire hazards, and we can get in there and start mitigating some of these opportunities to improve their life at home. So that's kind of where we're starting with the program, and we're finding great strides in gaining trust with the community members.
Ryan, you're a natural. Sounds like you've been at this program for a lot longer than you have. Thank you. Thank you. That's beautiful work. Jonathan.
Okay. Well, with the food insecurity, we also have a pantry out of the Cove facility here. We want to make sure that people of all ages have an opportunity. We work not just with families in need, but we also work with the unsheltered that are in Lakewood. We have several people that are coming to the community meals that don't have basic needs. It's not just food insecurity. So one of the things that we do to empower people is we also offer transportation. We give free bus passes to people, and depending on their situation, free monthly bus passes, so that way no one has to go out without. If you don't have a way to get to a community meal or get to a food pantry, you don't have a way to feed yourself. And that's a really big issue that is going too much unnoticed. We have at least 4 people unsheltered that come to the meals that I help at, and the people who are sheltered still struggle as far as getting there, getting home, or with other basic needs. If I'm spending money on one thing, I'm losing on another, and that's a really big issue for people. As I mentioned, 1 out of every 4 don't have enough. So we're trying to cover a lot of areas because poverty doesn't just go for hunger, poverty goes all over.
Thank you, Jonathan. Thank you. So the next thing that we would love to hear from you all about are particular challenges that you may run into in providing these services. And in the interest of time and focalizing perhaps 1 to 2 challenges that you notice in the delivery and the providing of these services to your clients. And yeah, we really ask that you do share these things from your lived experience so that people that would like to know and people that would like to help you can help you perhaps problem solve and meet needs that might be out there. So let's see. Jonathan, would you be okay jumping in on that? Yeah, okay. So some challenges that you run into.
So there's different challenges that we encounter, which is why we're trying to expand our services to the people in the community of Lakewood. Mentioning the fact that we want to operate a free store where people have basic needs that are free. Moms have Similac and diapers. The community that's unsheltered have clean socks, have something warm to wear, and something good to eat. Some of the challenges that we've encountered is when you're unsheltered, Lakewood right now doesn't have a lot of porta potties. If you have no money to go into a restaurant to be a customer, or you have no money to go get a cup of coffee, where do you go to the bathroom? So as we're talking about dignity and we're talking about improving the quality of the health, we also need to consider improving the quality where people can sustain their self-respect. That's a big issue. Where do people go that are staying in their car when you can only be in parking lots or streets for so long? If there were more centers such as Cove, that would be humongous for people to be able to have some place to go in the afternoon where they wouldn't have to stay in their car at Audie's parking lot. The other challenges besides this in transportation was just people having money to cover other expenses. When you're on a subsidized income, you barely have enough money for your rent, let alone having money for anything else. So what I consider a luxury and what other people consider luxuries are very, very different. It's kind of like the difference between Burger King and Starbucks. Starbucks is like the coffee of the coffee, and Burger King is when you don't have enough. So the challenge is just maintaining the quality while giving the dignity and the respect.
Thank you, Jonathan. I appreciate the wide-angle lens that you have on poverty and all these places that perhaps those of us that don't work right there on the grassroots level don't get to see. So I'm appreciating you bringing that to the surface here for us to be thinking about. Ryan, let's hear a little bit about some of the challenges you might be running up against.
So as I had said earlier, one of our biggest challenges that we're facing is just gaining the trust of our community, and especially the elderly population. Knowing the situation that they're in, we want to make sure that they feel safe and independent in their homes. So when we come in, a lot of times the elderly are already a little hesitant and concerned with what's going to happen next. If I do fall, what's the next step? Am I going to be able to come home? Am I going to have to go into a long-term care facility? And what does that look like? So early on, it's really just educating them on what's available to them and what the process is actually going to look like. And I see it kind of in two different areas, so it makes it a little bit more difficult to start to tackle, but we have a population that's already kind of in that life cycle of I've fallen, I'm seeing the health concerns that come along with that. So what we have to do there is learn how to manage that care and prevent things from getting worse. But then we also can't forget about the people who haven't fallen that are at risk. So we have to start developing programs and initiatives around that to help balance the two. So we want to manage the care where it's at currently for the population that's already have the unfortunate risks of falling happen, and then we want to be able to manage the large group of population in that demographic that hasn't fallen, that is going to be important to minimizing the first group that we talked about and really keeping people safe in their homes. And another challenge that we have is educating this population on services offered through our community, other healthcare agencies, and insurance companies. And some examples of this would be working with hospice, palliative care, home health care agencies, and outpatient therapy. When you start working with this demographic, you really start to see that these are the people they're seeing all the time and working with. So we want to be able to start integrating ourselves with those agencies and providing services that we can start navigating with them to enable them to stay in their homes and feel a lot safer.
Right on. Honoring that all good community work starts with relationship building. That's what I'm hearing. Yeah, especially our newer initiatives, just starting with the relation to the people and what their needs are. Wonderful. Sophia, share with us a bit about some challenges you might be seeing.
I think the most challenges that I see every day from our patients, just because we're seeing a lot more refugee patients, is language. So I think the language is a major issue. They could be in our office and we have translation services to help them out, but it's after the visit when we have to send them out for referrals and we have to send them out to our hospital systems. You know, they're handed paperwork that's in the English language and they don't understand. I mean, my parents are Greek immigrants and they go to the Cleveland Clinic and they come back with a piece of paper and they're like, what does it say? You know, I think we need to be more, I don't know what the word is, more thoughtful in that aspect of it. Maybe having the paperwork and the languages, that the patients speak. And I think that would be better for them as far as following up with their referrals, their appointments, their follow-up appointments, and it's giving better health care to the patient. And then I think another problem that I'm seeing a lot of, and it's transportation. Transportation is one of my biggest issues with the patients. Around Lakewood, it's great. We have lots of services for the seniors, for the regular residents just to get around Lakewood. But it's outside of Lakewood that we have the issue. And yes, I could use Provider Ride through CareSource, through United Healthcare, Community Medicaid, et cetera, but the feedback I get from the patients is they come, they give me 3 minutes, how am I supposed to run downstairs in 3 minutes? And they leave. And a lot of time our patients have been stranded at their appointments with no way to get back home. Then I have to reschedule that, and it's like very time consuming for the patient. And then with our refugee patients, a lot of them come from countries that they've experienced, the most horrific things in their life, and they're coming to a new country to start out. And I'm telling them, oh, this transportation's gonna come pick you up. They don't know it. They don't know that they're safe. So I think it would be great to have some type of transportation, either through Neighborhood Family Practice where we have our logo, where they could feel safe, they know that they could trust us, or maybe Lakewood could come up with some type of transportation system, the same with Lakewood's information on their, our emblem, so they know that there's trust, there's security, and they can't be afraid.
Yeah, thank you, Sophia. Yeah. Sure, yeah. Sure. Yeah, so we're welcoming some questions from the crowd. Does anybody have some things they'd like to know from our panelists, either about their programs or any other barriers to accessing or any learnings that they might have from their work? Yeah. We'll bring a mic to you so everyone can hear you. Okay.
That's my ability. Thank you. I just wanted to know, of the grant map we just saw, which grants did your organizations last submit an application towards? And how is the impact of that application cycle to your organization?
Yeah. So you'd like to hear a bit about the application process from the grant partners? Sure. Which grants? So I know Jonathan and I first became acquainted for the neighborhood opportunity grants. And then Kate might need to help me out, community level for our neighborhood paramedic program. Okay, yeah, I'm gonna swap those. Yeah, neighborhood family practice is our community level, which was that first one I had you repeat back to me. And then our system level grants is the pot of money that we use to support the neighborhood paramedic program for the city of Lakewood. Yeah. Other questions? Other things you're wondering about? It's a good chance to talk with grant partners about their experience with us as well, if you'd like to hear about that, if you're perhaps somebody considering seeking funding from us in the coming year.
Are these one-time grants, or can you apply for continuation of grants?
Kate, you want to come up and help? I could tell you all about neighborhood opportunity grants.
As we're starting as a new organization, you folks can apply for funding for the same program that's been funded previously in different grant rounds. We've done a little bit of multi-year funding or 2 years of funding for certain programs. We're looking to build out more multi-year funding as we go, and we start to expand and build our relationships and understand how to sustain programs over a longer period of time. It's a great question.
Two questions. One is, can you just talk a little bit about the difference between community grants and neighborhood opportunity grants? And then also what does, and I know this, but what does trust-based philanthropy mean? And how have you, I don't know if you guys have felt that difference, but obviously I know that's a big difference in philanthropy.
Well, I'll just note that your question about the difference between community grants and neighborhood opportunity grants is something that Jeff hinted at in the feedback that he got, which is that we heard from grantees that some folks are not completely clear about what the difference is between those. In the way that they're working is that the community grants are really programmatic based and really looking at supporting nonprofit organizations that are working on specific social determinants of health, including food, community and social contexts, neighborhood and built environment, and access to education. And we're looking at supporting specific populations around that, which include single parent heads of households, children and youth, older adults, and refugees and immigrants. So they're focused very specifically on certain populations and certain social determinants of health. The neighborhood opportunity grants are a smaller amount of funding, so those are for $1,000 to $10,000, and they're really designed to be project-based and to spur ideas, innovation, new ways of doing things in our community that haven't been done before, or taking a project or an idea and building on it so that more people can be involved. They're really sort of hyper-local. They're meant to spur grassroots activism. They're meant to spur like mutual aid and sharing of ideas. And so we're continuing to figure out how to build those out so that people know how to engage with both of those different grant processes so that they become more clear and that we can be even more effective in the way that we execute on those. Quickly, I'll note that trust-based philanthropy is a movement within philanthropy to really start to look and change the power dynamic that is inherent in the way that most funding relationships have historically worked, with the funder sort of being the sort of all-knowing, all-powerful kind of resource hoarding sometimes entity, and really switching to looking at being in partnership and breaking down both silos, breaking down a power dynamic that doesn't center the grantee as the expert in the relationship, and looking at ways in which you can build processes around grant making and around ways of engaging in the community that are both mutually beneficial, but then also allows for the funder to respect the time of the grantees, of the nonprofit organizations, making sure that the processes that you're asking them to engage in are not burdensome, that are not outsized for the amount of funding that you're giving them, and also are aligned with meaningful and realistic goals and ambitions that you're working on as a shared goal together. So I hope that was helpful. It's a high standard, but it is something that needs to happen in order to start to dismantle these power structures so that more and more people can work together, and that the philanthropy can be a partner as opposed to I don't want to be negative, but as somebody that that wields too much power in a community dynamic. Yep. I think we're going to have to start to wind down. So Khalila's going to end with a couple of closing remarks. I want to just make sure that we spend some time offering thanks to our grantee partners and to all of you for coming in and preparing such important remarks and sharing so much of the work that you do. We're grateful to be with you. We're grateful for the work that you do every day to serve the Lakewood community, people that may not be here tonight, but are touched and affected by the services and the work that you do every day. So thank you so much, and I hope you'll join me in welcoming and thanking them.
We also want to thank Courtney for being an amazing facilitator and moderator during this time and truly helping engage this. We know there might be more questions. If you want to write those down or leave those with Kate or any one of the board members here, we'll be happy to do so. We're very transparent about that. We will take those questions, reflect on them, and continue to share. That is the importance of this community meeting. And just in lieu of time, I'll just share a few things that we're going to think through for the year ahead. One is continuing to build the relationships with our board members and our incredible incredible grantee partners that we have today. Thank you so much, panelists, for sharing the work that you're doing and being so thorough and diligent about the mission of your work, as well as thinking through how to improve it and letting us know the barriers and challenges that you face. The other thing is that we want to create more opportunities for convening and learning with our grantees about community needs, structural barriers, and creative funding responses. Build our capacity to share our learning and to work with others to raise awareness, access, and accountability both ways, and thinking through how we can do that collectively, not only for individuals in this room, but all of Lakewood. It is a pleasure to serve as the board president. I serve on two foundations, one as well as on the east side with the St. Luke's Foundation, and being here as the board president. The thing I thoroughly enjoy about the relationship with the Healthy Lakewood Foundation is this continual opportunity to care and nurture the Lakewood community, and I think it is a motto and a reflection of all of those who serve on the board and the community who are open to both welcoming and pushing back on the things they want to see in this wonderful community. Thank you all. And Kate, do you want to have any closing remarks?
I want to just note Khalila's incredible leadership. As our board president, she has been amazing. This is her second and like 2.5 years, and she's just been an amazing partner and leader for all of us, modeling an incredible level of commitment to the community. I'll just note that we're incredibly grateful for your time this evening. We really encourage you to continue to engage with us. Please sign up for our newsletter on our website so that you can continue to get updates about when our grant processes are and the work that we're doing. We have a neighborhood opportunity grants process that is open through Tuesday, the 26th of September, so just a few more days to apply, and we are still happy to talk to folks who are interested in applying. So if you go to our website, you'll see on the Neighborhood Opportunity Grants page a way to access support, and it has lots of ways that you can reach out to us and schedule meetings so that we can talk to you about your ideas. We are always open to your ideas at any time. You can go onto our website and you can reach out to us via email or calling us to share ideas that you have or questions that you have about our work in the community. And we just hope that you'll continue to be involved with us. We appreciate your time and your interest in the work that we do, and we hope that we'll be able to see you out in the community at other events. And want to thank, again, our panelists for the great work that they do, and I'll thank the HLF board for the incredible dedication that they have to the community every day, and I hope that that is evident to you all here this evening. So thank you again for your time, and I just encourage you to stay connected.